Okay, is everybody hearing me?
Yes.
My name is Dr. Landsberg. I am an audiologist, and I currently reside in Coos Bay, Oregon, which is on the Oregon coast, so it's technically about 2 o'clock my time here. I'd like to thank you for attending. This is very dear to my heart. I've not only been born with Alports, but I've also experienced all this from hearing loss to renal failure, and had a kidney transplant at
The conference has been muted. The conference has been unmuted.
Okay. So I have some topics that I would like to discuss today. First topic is hearing loss. Second, the types of hearing devices, new technology, and the cost of hearing aids. First thing I want to touch on with Alports and hearing loss is, as we know, that Alport syndrome patients with hearing loss tend to have an abnormal collagen makeup in the inner ear. With that being said, Alport's patients tend to have a sensory neural hearing loss, which is damage.
Dr. Landsberg, I'm sorry, I'm going to interrupt you. We're not able to see the slides.
Oh, okay. I tried putting it on a couple of times, but it wouldn't let me.
Oh, okay. I didn't realize that when we were speaking. If you email them to me, I can put them on while you are speaking.
Okay. Okay.
And I apologize for this technical delay. While he is doing that, I can let everyone know that our next topic will be in April, and it will be focusing on women and Alport syndrome with Dr. Rowe from the University of Minnesota. So we are greatly looking forward to that.
Okay, so I just sent you those, so I should be good now. So the next thing I'm going to touch on is we're at a pretty good position, as we know from the research that the onset of hearing loss in Alport's patients tends to be early on in life. 50% in the teenagers, about 75% in the mid-teens, and then about 90% by age 40. So what this really does is gives us a good window to be able to identify hearing loss at an early age. The really interesting thing about hearing loss with Alports is patients will pass the universal hearing screening, meaning every child that's born in a hospital or a midwife's facility has a hearing test, so they will pass with flying colors on those tests. Even in the school, they will tend to pass the hearing test. So since we're dealing with the late onset, I highly encourage my Alport's patients to have a hearing test every year. One, so we can get a good baseline for where the hearing's at. The second is if we identify hearing loss earlier than the statistics, then we can provide intervention much quicker and avoid things such as speech delay. The other big aspect of hearing loss is I do encourage my Alport's patients to avoid loud sounds as much as possible, and if possible, to wear hearing protection. Now, I want to emphasize.
I'm sorry, if everyone else can put your lines on mute throughout the presentation, we can cut some of the background noise as we're currently talking. That would be great. We're getting some background noise, so if you are not Dr. Todd Landsberg, if you can put your line on mute, that would be greatly appreciated. Thank you.
Okay. So I'm not trying to discourage my young adults as well from listening to loud music or going to concerts, but be smart about the hearing a lot, because we know that the hearing loss will develop with Alport's patients, so we would like to try to prevent it as much as possible. So the more noise exposure a person gets exposed to, the more likely the damage will cause. There's also want to emphasize with Alport's, there is tends to be patients with Alport sometimes have tinnitus, the ringing in the ears. It's also associated with hearing loss, so that is another issue that we have to deal with. The tinnitus is subjective, so we don't exactly know what's truly causing it. But with my Alport's patients, the hearing loss and the tinnitus tend to go hand in hand. The next big topic that I want to go over is the hearing aids. There's two different types of hearing aids that are out on the market right now. One is the in-the-ear hearing aids, and the other one is behind-the-ear hearing aids. I'm going to touch on both the pros and cons to both, and I have worn both of them, so I know the sound quality is completely different on both. I tell my Alport's patients as well as my other patients, it really boils down to whatever the person is willing to wear. That's my happy compromise with my teenagers as well as my adults. The in-the-ear hearing aids, the big positive to them is they use the ear for the natural acoustics. These devices are custom made for the patient's ear, so they tend to be less visible. Patients tend to accept them more in the respect that they're very, very tiny. The con of this device is these devices are custom fitted for the patient's ear. So if the person's ear changes shape, either due to weight loss, weight gain, or a growth spurt, it can cause some serious discomfort issues. These aids often times tend to tend to last a little less, and then the other big thing I see with the in-the-ears is they tend to give off an echo sensation by plugging up the ear. The second device that I want to talk about is the behind-the-ear hearing aids. These hearing aids are very popular now, in part because it typically takes about a day or two to get the actual hearing aids. patients can choose from a wide range of colors. So oftentimes people will match the hair color with the hearing aids. But it all comes down to then again whatever the patient's willing to wear. The pro of this device is they will last longer because there's less of a piece that's in the ear, so they tend to break down less. The patient tends to be a lot happier with the sound quality because we're not plugging up the ear completely. The downside to this device is it typically picks up more background noise. The reason for that is the microphones are behind the ear instead of in the ear. The other problem with this device tends to be they're not custom fitted for the person's ear. They are making advancements in that right now and have gotten better, but it's a universal fit, so it's sometimes a hit or miss if how well it stays in the ear. The other topic that I want to discuss now is the new technology. People have been probably starting to hear more about these rechargeable hearing aids using lithium-ion batteries as well as silver-zinc batteries. My feeling with these is this is the first generation on the market. So like we all know from the iPads and tablets, when they first came out, they were really good. They were very expensive. But now that the second and third generations have come on, the kinks have been worked out. So, I would say if all possible, if you're interested in that kind of technology, to wait at least a year for all the glitches to be out. The other thing that I also want to talk about right now that is probably the number one question I get asked in my clinic is, thank you for putting up that slide, is the cost of the hearing aids. Now the cost can be is based on your local provider. I've seen costs as much as $2,000 to $12,000. This is where we have an edge as far as Alport's patients, is now that we know with science that it's a late onset of hearing loss. I highly encourage my Alport's patients to do your homework and make sure that you pick a healthcare plan that covers hearing aids. Because long term, this is going to be the best bet for being able to afford hearing aids. If finance is a real issue, there are a lot of other organizations at the state level that will help provide hearing aids. The one that I work with closely is the Lions Club. They tend to be very, very good. But a lot of the regulations through the states completely differ. The other thing I highly recommend is going to a doctor of audiology, specially trained. You will sometimes see a lot of people that are highly encouraged to sell hearing aids, so they will offer buy one, get one free tests and everything. They are really pretty much all out to sell hearing aids. Audiologists are going to be a little bit more knowledgeable. They have a lot more insight on Alports. Even when I was taking my board exam, one of the main questions on it happened to be regarding Alports. So we do know that the doctors of audiology tend to have strong emphasis even in Alports. The other aspect and the last aspect that I'm gonna cover, and then I'll lead it up to questions, is some of the resources.
I'm listening to something on the computer about Alport syndrome and hearing aids.
Mm-hmm.
What are you doing? Yeah.
Oh, hi.
What?
If everyone can please mute their lines so that we communicate, so that we don't have background communication, that would be wonderful. Thank you.
Okay. One of the big resources that I very much like is the Hearing Loss Association of America. They have a really good website. They also tend to have a lot.
Well, he needs to go over there. Somebody needs to be with him. He does not need to be by himself.
The conference has been muted.
Hi, just again, if everyone can please mute their line, we would greatly appreciate that.
The conference has been muted. The conference has been unmuted.
No,
Okay. Getting back to the Hearing Loss Association of America, really good resources for patients with hearing loss. They don't specialize in Alports, but I highly encourage my Alports patients to check out this website. One, because like this support group that Alports has, the Hearing Loss Association has a lot of local events and chapters in various states and various cities, and they have a lot of insight about the different resources for that city. So I really highly encourage. I've gone to a handful of meetings, and it's very fascinating, the different presentations, the different things that they have as far as groups. The other thing that I put emphasis on is this program called LACE. It's a interactive listening program. It tends to help with the hearing aids with the listening aspect. It's designed for patients ages six and up, and what this is going to do is it's going to help improve the listening aspect of the hearing. If you have any more questions about that, you can either see them on the web, lace.com, or you can contact me. The other resource that I'm really impressed with is the Better Hearing Institute. They have a lot of information about hearing loss, but most importantly about the new technology and the local celebrities as well as professional athletes. It is really fascinating. It makes you kind of feel a little bit better when you realize one of these athletes that you've grown to know throughout the years also has hearing loss. And a lot of the celebrities and athletes are very open to taking suggestions from other various patients. The other aspect is Harris Communications. Now this company specializes in all sorts of different listening devices, such as doorbells, alarm clocks, anything you can kind of think that is related to hearing loss, phones, a lot of good resources from this company that will better help the hearing impairments daily living. And then the last aspect that I highly encourage patients to utilize is their local audiologist. They're going to have a lot of the knowledge and resources about anything that is going to better provide better hearing. I do try to help out in any way I can through the Alport Foundation because this is very dear to my heart. So if you email me, I typically will try to respond within 24 hours. But I touched on some of the major issues, and I hope that you got a lot out of this presentation. I didn't really have any insights as far as how knowledgeable everybody was going to be on this conference call, so I'm sorry if some of the stuff was a little small, but the statistics and everything about Alports, I know it's not exact science, so a lot of this was we don't exactly know per case which when the hearing loss is going to develop, but I really think that by having an annual hearing test on my Alports patient is extremely useful to monitor the hearing. In my experience with my clinic, I have not seen significant declines in hearing with my Alports patients, which is a good thing. So we know that the hearing is very stable. But if you go to rock concerts or you go logging on a day for a daily living, that can change pretty quickly. With that being said, if there's, I will stay on the line for a while if you have any questions about any of the stuff in my presentation.
Great. Thank you. We have one question online. If anybody has any questions, please type them into the chat online. The first question is, I've always worn the in-ear hearing aids. I also wear glasses. Will the behind-the-ear hearing aid interfere with the fit of my glasses?
Very good question. I am currently wearing glasses myself. No. We can make the devices that are behind the ear a lot smaller so they do not tend to rub with the glasses. But no, I've done everything with these hearing aids, run with them, bike with them, shouldn't interfere with the glasses.
Great, thank you. We have someone who has raised their hand online indicating that they have a question. Wendy Caruso, if you'd like to unmute your line and ask a question, or she typed it in. Can you please clarify how progression of the disease affects and or worsens hearing loss?
That's a very good question. The progression, well, like the slide I have up right now, this is kind of a rough idea of where we're looking at as far as the progression. The 50% in the teens, 75% by age 20, and then 90% by age 40. The only way we will know the progression of the hearing loss per individual case is by having an annual hearing test, because each case is so unique in its own way with different variables. By having a hearing test every year, we can at least start intervention a lot quicker. So if my Alport's patient said, well, if it's not going to be start the onset until early teens, I'm only going to have a test in my teens. You know, I would rather err on the side of caution of starting early. My hearing loss started at age 5 and progressed until about my mid-20s, and then it leveled off. A lot of research in this aspect needs to be done. And unfortunately, a lot of the research is on hearing loss is more geared towards some of the VA, more adult stuff. But that's a very, very good question.
Great. We have a few more questions. Our daughter is 7 years old. I know girls aren't as affected, and 7 may be young, but she's having symptoms of hearing loss and has started stating frustration because she cannot hear well. We are getting ready to have her retested. What should we be looking for in the testing? What part of hearing is initially affected? And also, what are the first symptoms or things that can affect hearing?
The first thing, I think it's great that you're having the child tested. Oftentimes with hearing loss, the parents are the first and foremost people to identify it, and you'll see this a lot with my adult patients. Is the spouse will actually identify the hearing loss more and understand it more than the patient. With that being said, I would have the person see the audiologist and emphasize on telling the patient, the audiologist, that you have Alports. They will kind of look for various things, but they might even most likely do some specialized tests at that visit just to cover every aspect, because there's certain tests that when a person tells me Alports or certain things that I wouldn't typically test for on that visit. One is a test called otoacoustic emissions. It's a test that can objectively tell us the structures of the inner ear, the hair cells in the inner ear, without a person having to respond. So sometimes damage will show up on that test, and that actually show up on the hearing test. But I think it's great that you're getting that second opinion. That's terrific.
Great. Is one type of hearing aid better for severe hearing loss?
No, it all depends on. Well, there's all sorts of different hearing aid companies out there, so that's a tough one. It's safe to say that pretty much every company their technology can fit a severe hearing loss. Keep in mind the differences between hearing aid companies is really how the hearing aid processes sound. So I oftentimes will encourage my patients to try 2 or 3 different manufacturers to see which one they like the best, because a hearing aid is almost like trying to choose some shoes. Not everybody's will fit into Nikes very well. Some will prefer Asics. Some will prefer New Balance. So with that being said, all of them will fit the severe hearing loss. The question is which is sound quality wise you're going to prefer.
Thank you. Do children adjust better to hearing aids if they get the hearing aids at a younger age?
Yes. They oftentimes will adjust better because if they start to notice the benefit, they're more inclined to wear the hearing aids as well as the glasses. That's how I can get my younger patients in hearing aids quicker. Is if you can kind of let them kind of go with the flow, pick out the color, the size. They can be more accepting. They're also, like in my case, I was not even used to knowing what I'm missing. So whatever I got, it was an improvement on what I had, and I was just happy hearing other things. From 5 down the road, I had no concept of what real hearing was like. Depending on the age, that the child might fight it, but I think if done properly, they'll see the reward.
Great. Will a successful kidney transplant prevent or reduce hearing loss?
Typically, what I've seen in the past, I've seen is the hearing loss will level off. A kidney transplant will not restore the hearing. Damage to the inner ear is permanent. So the only thing that can help with that right now is a hearing aid. They are currently working on ways to restore inner ear damage. However, it's still in the research phases. But what I've seen with my transplant patients is it doesn't get any worse. It typically levels off.
Great. And kind of in that same vein, what are your thoughts of new renal function therapies such as bardoxolone methyl, which is an anti-inflammatory drug that's in phase 2 trials for Alport syndrome, in helping hearing in Alport syndrome?
I highly that's all based on what the nephrologist thinks. That's a case-by-case thing. The medication itself is not toxic, so it wouldn't be causing any troubles with the hearing. But that's a call. It's based on what the nephrologist feels.
Are there any efforts then in combining strategies to preserve renal function and correlating those studies with measuring hearing loss to ascertain if the therapy can help hearing?
I know there is a few researchers that we're currently looking into possibly. I did have a PhD student that reached out to me a couple of weeks ago wanting to help participate in that research. I think it would be really very much highly encouraged if we could do that, because the big thing would be having a baseline so we would know where the hearing's at prior to starting the treatments, so we could actually objectively see if the hearing is even improving. I have, since this is so new and it's never been tried, we really don't have any expectations going into it regarding hearing. If it improves the hearing, I would say that's just incredible.
Great. We have a question here. We are working with our 13-year-old son in selecting his first hearing aid. He is leaning toward an in-ear device. You mentioned testing brands of hearing aids. How can this be done with in-ear hearing aids if they require a custom fit? With typical 60% cookie bite deficiency in both ears, is there a certain brand that you would prefer or recommend?
I mean, as far as the brand, I mean, the current brand I'm wearing is called Phonak. That's PHONAK. But I kind of leave the expertise on that end to the local audiologists that are going to work with them. Because, like I said before, the difference in technology, it all comes down to the provider that's going to be working with them on the local level.
Great. Can you say more about the insurance coverage for hearing aids? Are most plans these days offering coverage? Do you know of any plans that cover hearing devices better than others?
Currently, I mean, and this is speaking from a West Coast, I know that the vast majority of the commercial plans are offering discounted plans at the very least. But off the top of my head, I would say a lot of the federal plans are very good. And that's such a hard thing because it's all based on the plan you choose. And so when selecting the plan, that's one thing that I encourage people to do. So if you're looking at pharmacy choices, that's another thing to look at. But since the late onset, I just think it's that we have at least a window to actually prepare for it. So by having that additional coverage, it is really, really going to help out long term.
Great. How early or young or at what amount of hearing loss is it recommended to start thinking about using hearing aids?
Wow, that's a good question. We have the technology to fit infants as early as 3 months right now. With that being said, I mean, fitting hearing aids is all based on benefit. So it's all based on, as parents, as providers, it's all based on what the person is missing out on, because each hearing loss is unique. And what one person might come into my office saying that they're not missing anything, another person might come in with that same hearing loss saying that they're missing everything. So it's based on how much do you really feel like you're missing, because that's a lot of research is very it's very tough to make a call like that, because it's all based on how much you feel in your situations you're missing out on. The local audiologist will do a very good job with giving you the numbers as far as if you are a candidate for the hearing aids based on insurance, based on other variables. But fitting the hearing aids is a lot of it is a science based on how much is that person, when they come into the clinic, telling me that they're missing out on.
Does the use of ACE inhibitors in any way reduce or reverse the level of hearing loss?
To my knowledge, ACE inhibitors does not have any effect on hearing loss. And it will not reverse the damage to the inner ear.
All right. How do you get access to LACE?
It is a online software based. So I can give you some. If you give me your email address or you send me an email, I can give you all the details on that.
Okay. And with that, we did have a question for your email address. That email address is available on our website, but if you want to provide it now, that I'm sure would be greatly appreciated.
Okay. Yeah, I can. Okay.
And we do have his email address on our website as well, and we can add that to when we post this presentation online. We can post it there as well. But if you'd like to share it now.
Just did.
On the chat.
Yeah.
Wonderful. And so for those of you who are watching this or for listening to this presentation online after the fact, the email that we have for Alport at the Alport Syndrome Foundation is hearingloss@alportsyndrome.org. Dr. Landsberg has also offered drtlandsberg@gmail.com. So that's drtlandsberg@gmail.com. Do you find in most cases the hearing loss level off?
Yeah. In a lot of the cases, the hearing loss level's off. A lot because traditional patients with hearing loss, that it's caused by either age or noise exposure. My Alport's patients typically have more of a cookie bite / kind of flat hearing loss. Those tend to be much more stable and less progressive than the noise exposure stuff.
You mentioned bugs in the advanced new technology of hearing aids. Can you review these in more detail? How would you rank their quality of natural hearing versus traditional in or out of ear devices?
I would say natural, versus traditional in the ear devices. The natural hearing between the two, that's a lot of it's based on the company as well as where the damage in the hearing is in relation to the hearing test, because with some of my patients that have actually really good hearing in the low and mid frequencies, we are solely trying to emphasize our work in the high frequencies. So we're actually just trying to preserve certain sections. So it's really that the natural aspect of hearing is we're trying to preserve whatever is good and to come in naturally and only focus on what's been damaged.
Does the blood-brain barrier keep the new renal drugs from reaching the ear?
I'm not exactly sure on that. I'd have to look that up. I'd have to look at which medications that you might be referring to.
Okay. Pros with Phonak.
Pros with Phonak, the technology is they're one of the top 5 manufacturers in the industry. They tend to focus a lot of their attention on pediatrics, so they have what I consider to be probably one of the best pediatric lines in the industry, and the features with their hearing aids tend to be very good.
Where can you find financial support to pay for hearing aids?
The Hearing Loss Association of America has a lot of resources on that under financial assistance, and they actually are good enough where they actually have state level funding resources on there that is specifically to your particular state. The one that I know that is national across the board is the Lions Club. The Lions Club are very well known for hearing loss as well as vision.
Thank you. Do we have any more questions, either online or if you would like to unmute your line and ask a question, now would be the time to do so. We have many expressions of gratitude online for you.
Oh, excellent.
And just to reiterate the email addresses, there may have been an error in one that we gave. You can reach Dr. Landsberg at hearing@alportsyndrome.org or at drtlandsberg@gmail.com. He's been kind enough to provide us with his contact information should anyone have any questions. Well, if that is all, thank you so much, Dr. Landsberg. We very much appreciate this information and the time that you've taken to answer all of these questions. And thank you all for joining our presentation. We'd also like to thank the sponsors who have helped make these presentations possible through our Ask the Expert series, which is Global Genes and Riata. So thank you to them for their support. If you have any questions about anything about the Alport Syndrome Foundation, please feel free to reach out to us anytime. And thank you all again for your participation. Dr. Landsberg, we are so grateful for your time.
Thank you very much. Okay.
All right. Thank you.
Okay. Thank you.